Welcome to another episode of the 3-Minute Therapy Podcast with David Ramsey Steele, my co-author and podcast partner, and me, Dr. Michael Edelstein, clinical psychologist, and David's podcast partner, needless to say. Today, we're going to be discussing the question, is all therapy really psychotherapy? And as a practitioner of rational emotive behavior therapy, REBT, devised by Albert Ellis, I would make the case that what we do as REBT therapists is not traditional therapy. It doesn't follow a psychological or therapy model. It follows an educational model. So we're more teachers as REBT therapists and therapists. We teach people concepts, strategies, tools they can use to overcome their emotional problems. So it's more of a teaching aspect, a teaching process. Now, traditional therapy has certain features, and one is to get at the roots of the problem. What's the deep cause of your emotional problem, your anxiety, your depression, or anger? And their answer to that is look at your childhood. You were brought up in a dysfunctional family. You had an overprotective mother, absent father, and that's why you have the problems you have today. But the research doesn't really support that. It supports that that's somewhat of an influence, but it's really not the main factor. The main factor is genetic predispositions, and that studies from infants from 3-6 months on can predict what their adult personality is going to be like based on how they react to various stimuli, how active they are, inactive, how much they smile, laugh, how much they cry and fuss around. So that's more predictor of adult personality than how the parents treat them. So we don't really go for childhood roots of the problem. And we go for a deep cause of the problem, but the deep cause is your thinking. Your thinking when you feel disturbed or act destructively, self-destructively, it's your thinking, what you're telling yourself, the ideas, philosophy, opinions in your head that cause your disturbance. And those are the roots, not your childhood. Also, therapist tends to, in traditional therapy, the therapist tends to do a lot of empathic listening. I understand how you feel. That must be hard. Tell me more about it. Whereas in REBT, the therapist is still empathic in the sense that they want to understand what you're experiencing and feeling, but it's more in the service of helping you identify your irrational beliefs, your must, should, supposed tos, have tos, your demands that cause your problem, than in terms of understanding how you're feeling. The claim is made against REBT that it denies feelings, but the opposite is really the case, because we start with feeling with clients. How are you feeling? I'm anxious, I'm depressed, I'm angry. And the goal is to help you overcome or minimize those feelings. So we are concerned with feelings, but not in the obsessive way that traditional therapists are. David, did you want to make a comment at this point? Otherwise, I can go on with some more aspects of traditional therapy and its difference with REBT.
Yes, well, of course, it's a well-known principle of learning that you learn better by doing something active. You know, even if you just want to learn a language, it's better to practice speaking it and not just listening to other people speaking it. Even if you just want to learn a language for reading purposes, it helps if you write out sentences and things like that. So in the old-fashioned Freudian approach, the client's opinions, thoughts, and even feelings were not treated with much respect, and the client simply poured forth various kind of phrases and sentences, and the analyst looks for the coded meaning of what it is. So, you know, that's a very passive role for the client. So I think that what REBT does is much more in line with pedagogical theory. We are trying to bring about changes in the lives of clients, only the kind of changes that they want, not arbitrary changes that we think they should have, but changes that will help them to achieve their goals. And in order to do that, it's almost essential that you cause them to to do something active, you know, and it may vary with the person and with their culture and background. Some of them will come to therapy convinced that the therapist is going to work wonders and they just have to listen. And so that may be something that you have to overcome sometimes.
Yes, good points. We practice in REBT and encouraging clients to change their actions and behaviors in addition to changing their thinking is a highlight of REBT, which, as David is pointing out, is different from conventional therapy. Also, another difference is that in traditional therapy, as David is saying, the therapist doesn't give advice or direction, whereas that is a central part of REBT, where you teach clients what irrational beliefs consist of, because these are the root of their emotional and behavioral disturbance. And then we encourage clients to do things about it, question, challenge, contradict their irrational beliefs on a regular basis, as you're saying, David, practice, practice, practice. And we suggest behavioral assignments to risk disapproval, to force yourself to do what you're avoiding doing, those kinds of things. Also, in traditional therapy, along these lines, the therapist normally does not give homework assignments, whereas a feature of REBT is at the end of every session, the therapist and the client collaboratively come up with some things they can practice, often cognitive things, questioning and contradicting their demands for approval, or their demands to be treated well, or their demands to have an easy life, to question, challenge that again and again and again, and then act against it. So, and sometimes bibliotherapy. So those are some homework the REBT therapist gives that in traditional therapy, that's pretty much verboten. Another aspect of REBT, which is absent from traditional therapy, overlaps with some of the things we've been saying already. We teach basic principles. Where do emotions come from? They come from your thinking. What can you do about that? Another basic principle: use the scientific method, question, challenge, and look for the evidence for your thinking. And then tools to do that, we have, I call it 3-minute exercises. Most therapists call it the ABC exercises, where you outline A, B, C, D, E, and F, a particular situation that you find problem, you find a problem in the irrational beliefs that you're telling yourself about them, your undesirable emotions or behaviors that come from those irrational beliefs. And that's A, B, and C. And then D, E, and F, disputing your irrational beliefs. E is developing a better perspective, a more reasonable philosophy. And F is a new feeling or behavior that emanates from changing your thinking. Finally, in REBT, or most cognitive behavior therapy, the client does less talking as they do in traditional therapy. The client is encouraged to express their feelings ad nauseum, and to discuss situations, often childhood situations, whereas as a teaching mode in REBT, we do most of the talking, as in teaching, because we're teaching these methods and tools, concepts, and strategies to the client. And hopefully they're listening intently, taking notes, recording the sessions, and reviewing that information many, many times. So those are the main aspects of traditional therapy as contrasted with rational emotive behavior therapy. And to get more details, I suggest you get the book that David and I wrote, which is 3-Minute Therapy, and it's available at Amazon. And read the book 5 or 10 times. And if you have questions, let us know. We'll be happy to answer your questions. David, did you have anything else to wrap it up?
Well, just to add to your point, in Freudian therapy, psychoanalysis, the main skill that the analyst needs is the ability to sleep without snoring. Because and that's a skill that, you know, it takes a lot to acquire that skill. And this is not something that is a skill pursued by REBT therapists.
That's exactly. We try to, our skill is to stay awake.
Right. That can be difficult.
What's that?
That can be difficult.
Yeah, sometimes that can be difficult. So I always take a nap before seeing clients. That's a recommendation to REBT therapists.
Right.
Yeah. Okay, if you have questions or comments, put them below. Give us a thumbs up. Give us a tip in the Patreon hat. And what else could I suggest? If you'd like to be a guest, come on. We're looking for guests. We're going to be having a guest in a few weeks who's an REBT therapist who has some questions for us. And be sure to stay tuned to the REBT 3-Minute Therapy podcast to stay on the rational side of life.